Inshallah, I'm going to share with you a nice example of kidney tumor called mucinous tubular and spindle cell carcinoma of the kidney. Usually it is a low grade carcinoma. Here we have a representative section from a tumor which is quite circumscribed. Here we can appreciate the normal kidney with inflammation. So here we have the tumor, and we can see from this power, this is this very low power, the here and here collection of foamy histiocyte, which is I'm not saying characteristic, but is a feature of this tumor. This is the foamy histiocyte here and here, surrounded by spindle cells, and there is tubular formation. From this power, we can not see any ATP or high grade features of the cells itself. So if we go higher power, we can see here the spaces, or it's like a regular line of the tubules that lined by cuboidal lining with no atebia. So here if you go high power, there is also scattered inflammatory cells in this tumor, which is common finding, and most of the cells that we see here we can see this tubule lined or maybe a vessel, but usually the tubular formation are lined by cuboidal cells which are bland. Here a perfect tubule which is lined by this cuboidal lining. We can appreciate the nucleoli, but it's usually bland, so there is no high grade feature of on the cytological level. So the tubular formation, usually the tubules are irregular in shape and elongated, which is very important feature. Here collection of inflammatory cells, foamy histiocyte here and there, and I will go to a very good area of tubular formation. Let's go low power here. Maybe this example is different, but this is a tubular formation. I mean different, it's a little bit busy tumor, to be honest. Busy slide of tumor cells. Usually there is myxoid area in between the cells, and here the tubules or tubular formation. This tubule is elongated. Maybe this is not the best example, but it can do the job. Here the tubular formation, as we can see, the most importantly is the atebia. We have low grade atebia or no atebia at all, bland cells, foamy histiocyte, bland tubular formation, and spindle cells, and with also very important feature, the mucin or myxoid stroma. So this is mucinous tubular and spindle cell carcinoma of the kidney. Here, if you can see here is the myxoid or mucinous stroma. Here is the mucinous or myxoid stroma in the periphery of the lesion. Okay, so let's do a quick recap. So mucinous tubular and spindle cell carcinoma of the kidney, usually female predominance, and it is also incidental finding in most scenarios, considered as low-grade carcinoma. As we mentioned earlier, elongated compressed tubules, spindle cells, and myxoid stroma. But usually the myxoid stroma is more than what we saw. And also regarding the immunohistochemistry, the CK7 is positive. This is CAM 5.2 and pancreatin are positive. CK20 is negative. AMACAR is positive. and VSTM2A may be specific marker for this tumor. Regarding the differential diagnosis, we have collecting duct carcinoma. Usually, collecting duct carcinoma is a high-grade carcinoma, a regular small gland, an inflamed dysplastic stroma. The cells are lined by highly atypical high-grade cells with hobnail appearance. This is a picture of collecting duct carcinoma. So it makes tubules, but the tubule are showing stratification with high-grade features, hyperchromasia, and nuclei. Here also, this is definitely high-grade. If we go, this is maybe the lighting is very powerful, but if we go high power, there is a high-grade feature of the cells. That's it, and thank you very much.